Now in the fourth section, we will discuss about the treatment options for the cancer of the larynx. And different treatment options are the radiotherapy, conservative surgery and total laryngectomy, endoscopic resection with carbon dioxide laser, and organ preservation. So the treatment depends on, the treatment choice of the treatment in the cancer, we have depend on different factors. So in this case, the treatment option depend on the site of the lesion. What is the site of the involvement of the laryngeal cancer? And we already mentioned that the three sites are very common. We have supraglottic, glottic and subglottic sites for the cancer. So it depends on the site of the lesion, extent of the lesion, and presence or absence of the nodal involvement and distant metastasis. So all these three factors are very important in deciding what will be the treatment option for the cancer of the larynx. Treatment strategies, we have radiotherapy, surgery, which can be conservative laryngeal surgery or total laryngectomy. Complete larynx can be removed, or we can preserve some portion depending on what is the extent of the disease. Combined therapy, both radiotherapy and surgery. Surgery with pre or post-operative radiotherapy. Then we have endoscopic carbon dioxide laser excision of the lesion. Organ preservation. So all these are different treatment options: radiotherapy, surgery, combined therapy, which can be surgery with pre or post-operative radiotherapy. We can give the radiotherapy before or after the surgery. Endoscopic carbon dioxide laser excision and organ preservation. Radiotherapy, again we have curative radiotherapy for early lesion, cancer of vocal cords without impairment of mobility, 90% cure rate after radiation. So very important, radiotherapy is used for early lesions, and the mobility of the cord is, if it's not affected, if it's not impaired, the cure rate is very high, which is about 90%. Preservation of voice is an advantage of the radiotherapy. Superficial exophytic lesions, especially of tip of epiglottis, epiglottic folds, 70 to 90% cure rate. So depending on the site, what area is involved, the rate of the cure vary depending on the site. In epiglottic fold and tip of the epiglottis, the cure rate is not very good, but it's pretty good, but not as good as with the vocal cord. Radiotherapy, we usually don't have good results in the fixed cords, subglottic extension, cartilage invasion, and nodal metastasis. So there are limitations for radiotherapy, and this treatment is not effective very much if the cords are immobile and they are fixed, if the lesion is extended to subglottic region, cartilage invasion, and nodal metastasis. These require surgery, usually if the radiotherapy is not effective. Then conservative surgery, preserve voice of the patient because larynx is not totally removed, avoid permanent tracheal opening, and it includes chordectomy via laryngofissure. The cords are removed and the route is by laryngofissure. Excision of vocal cord after splitting larynx. Then we have partial frontolateral laryngectomy, which is excision of vocal cords and anterior commissure. Partial horizontal laryngectomy, in which there is excision of supraglottis, include epiglottis, epiglottic fold, false cords, and ventricle. Transverse section of larynx above vocal cord. So all these are these conservative surgical methods in which the voice is preserved, the total larynx is not removed, only some parts are removed depending on the extent of the lesion. Total laryngectomy or complete removal of the larynx. In this, the entire larynx, including hyoid bone, pre-epiglottic space, strap muscle, and rings of trachea are removed. So in total laryngectomy, all these areas or parts are removed. Pharyngeal wall is repaired after laryngectomy, and low tracheal stump sutured to skin for breathing. So tracheal stump after the larynx is removed is sutured with the skin for the breathing. Can be combined with block dissection depending on the involvement of the lymph nodes for nodal metastasis. So partial conservative type of surgical techniques and total laryngectomy both can be used depending on the extent of the lesion, whether we can save the voice by saving some parts, partial laryngectomy or total laryngectomy. Total laryngectomy is indicated in conditions when there is T3 lesion, all T4 lesions, invasion of thyroid or cricoid cartilage, bilateral arytenoid cartilage involvement, lesions of posterior commissure, failure after radiotherapy or conservation surgery, and transglottic cancers causing cord fixation. All these are indication for the total laryngectomy, and again, the main decision making is depending on the extent of the lesion. If the tumor extended deep or far, then the total laryngectomy, sometime with block dissection, is required. Contraindicated in patients who have distant metastasis because then the cure is not complete. Combined therapy, we have surgical ablation combined with pre or post-operative radiation. It decreases the incidence of recurrence. Pre-operative radiation before operation renders the fixed nodes resectable. So if the radiation is performed before surgery, some fixed type or immobile nodes, usually they are easy to remove. Endoscopic resection with carbon dioxide laser. This is the picture where we have rigid laryngoscope, not flexible, laser micro manipulator, and stereo microscope. So endoscopic resection with carbon dioxide laser. Mobile membranous vocal cord carcinoma, treated with radiotherapy, excision by carbon dioxide laser under microscope. So what type of cancer is used treated by the carbon dioxide laser? Mobile membranous vocal cord carcinoma. Advantages are lower cost, lower duration of treatment, and the morbidity. So these are some advantages of the carbon dioxide laser therapy. Again, carbon dioxide laser is used T1 lesions of supra or infrahyoid epiglottis with or without neck node treated with carbon dioxide laser. Cervical nodes managed with neck dissection. So the tumors which are treated by carbon dioxide laser, we have T1, which are supra or infrahyoid epiglottic type of lesions. Technique is getting more and more popularity because of the low cost, less time. So that's all the benefits of the carbon dioxide laser therapy. Organ preservation, laryngeal preservation, loco-regional disease control, in which there is induction chemotherapy before radiotherapy is used. Concurrent chemoradiation preserve laryngeal function. So this treatment, in which there is induction chemotherapy, is done before radiotherapy. It preserves the larynx, and that's the procedure in which the organ is preserved. Improves the quality of life. Concurrent chemoradiation causes more toxicity. That's one mean for the avoidance of chemoradiation, because of the toxicity and the side effects. So that was all about this section. Thank you for watching sqadia.com.